Today's topic, ADHD. This topic is taken from my new book. Most of you, all of you will get, the new batch or the old batch people who are just waiting. They have decided to wait for the new book. This one you will get. I will tell you one story, a comparison of two children. Okay, so there is one girl and one boy, both around age of 10 years. I'm interviewing them, and the girl is very cool, calm. She's sitting on a seat and in a chair, and the boy is uh, like always moving and all this thing. Okay, right. But when you interview, right, in the first glance, you may think that boy has ADHD. The boy is not stable or very hyperactive. These are just the childhood thing, a normal thing, right? But when you interview them, you ask, how's your school? Do you like your school? So probably both will say yes. Then you ask, do you like your friends? So the girl says no. The boy says yes. The boy is shaking. Okay, the boy is like moving arms and not stable in the chair. But the boy says, yes, I have friends. Then you ask, uh, are you able to make friends? The girl says no. The boy says yes. Are you able to continue your friendship or do you often get into fights? The girl says, yes, often I get in fights. I don't get along. The other children, they do not get along with me. They do not understand me. The boy says, yes, it is very easy for me to get along. Till now, the boy is moving, arms, everything, and looking here, there. The girl is very stable, cool and calm. Right. But the life is different. Okay. Then you ask, how is your score? The girl says, I'm scoring good. The boy says, I'm not scoring, I'm just average. Right? I like playing. And the girl says, I like doing different things. And I get bored very easily. So I start to do something. I play with one toy, and after a few minutes, I want to play with another toy. I want to play another game. The girl is very stable in a chair. So according to you, both are 10 years, right? Who is ADHD child? The boy or the girl? The life is different. But the behavior pattern is also like the behavior manifested right now in this chair is different. So which one has? It is just a natural tendency of a child, a curious nature. The child is seeing here, there, and not sitting in the chair, right? But the actual life manifestation, what is the trouble happening is the girl is suffering more. She is unable to make friends. She is unable to get along with other children. She always gets in fight while playing with other children. And she gets bored with one thing. She wants to move from one thing, one activity to other. So here, the girl is ADHD, right? Just by behavioral manifestation, you cannot identify ADHD. Someone is hyperactive, someone is fighting, playing, screaming. That child is not ADHD. The child who is living the dysfunctional life, even though outwardly the child is calm or introvert, that is ADHD. So ADHD, number one rule, has nothing to do with being introvert and extrovert, right? So there can be introvert childs and they are suffering with ADHD. True. So we need to identify these children. We need to convince the parents that the trajectory of their life is going to be different. They may have relationship issues. They may have work issues. unstable job, unstable relationships, unstable marriage, and lot many things. Maybe this child will accomplish wonder, right? If you guide this child properly, right? If you take my help early, if you intervene early. So ADHD child do not like ADHD is not a disease, right? It's a condition. Someone is born with a superpower. It's absolutely okay. They cannot make friends, they cannot do certain things, but they are good at what they choose to do. They can focus. If they decide to do something, they can do it, right? And we need to help them do that, right? Sometimes, if you see, there are some LinkedIn profile, they say that they are social entrepreneurs, right? And that makes you wonder, are they really ADHD? Oh my God, there is a good possibility because they get bored with something, then they jump into something. And have you seen some resumes? There are like 3 months they work, then 1 year they have a gap, 6 months they have a gap, right? So what is going on? They're unable to maintain that. They get just bored. They don't care. Do you know someone who has ADHD? How many of you know? Or you feel that you have ADHD? We will do just 10 second social experiment to identify how many of you are ADHD. Okay. So those who wrote, sir, you are on mute, you are on mute. You need to evaluate yourself whether you have ADHD. That was a test actually, right? So just we don't have a patience for 10 seconds also. Sir, you're on mute, you're on mute. Just before the mute button is pressed, you will start typing. Sir, you're on mute. Okay, that's really good. Okay. So and what about you? Do you know someone who has ADHD? Okay. So this is not a diagnostic. This is just a human nature. You're curious. It's okay. This is not ADHD. Okay. You are probably ADHD if you have relationship issues, if you are unable to maintain jobs, or if you are unable to focus on a task, or if you jump between one task to other. Right. So what is ADHD? The full form. Someone like just before class, Shilpa, she just called me and said, "Sir, today topic is ADHD. Can you tell me what is ADHD?" I was like, okay. Yeah. So you pay me 1 lakh rupee, I will take your separate session, right? So why don't you attend my session and then learn there? So ADHD is attention deficit hyperactivity syndrome. So these people, they have, these children, these adults, they have so much hyperactivity, so much uh, chemicals being secreted, they are unable to focus on one thing at task, right? And you need to train them to control their impulses, control their behavior, right? And if they do that, they will do very well. So just give very, very little, small tasks to them, means assignments, like whenever you have impulse to do something, delay it by 5 minutes. Whenever you have impulse to go for a shopping, delay it by 1 day. When you go for a shopping, do not go to a store and search what you need to buy. Make a list, stick to it. When you go to shopping, do not take your credit card or just take some particular amount and spend within that, right? I can see some of you are laughing because when you go to a shopping spree, you're like completely 1 month salary is gone. Okay, very good. So, in one of I'm also for fellowship book next for next batch I'm writing for psychological test, collecting all the psychological tests, so you can probably use that psychological test on yourself, but in that disclaimer is mentioned, do not use it for yourself, the number one line, and second is do not use it for diagnosis, use it only for fun. So doing too many things, multitasker is not ADHD, you know. So multitasker, do you know that multitasker, they are less efficient because they do so much things multitasking that they're unable to give the outcome. So if someone is uh, like a multitasker, it will be beneficial that you finish one task, focus, right, and then move to the next task, and that will not drain your energy, that will conserve your energy, and you will be able to do more. So again, multitasker is not ADHD. So there are some diagnostic symptoms which we will see now. We'll ask questions. Pooja, please ask in the chat now if it is okay. You want to ask now? Okay, ask. Related topic only.
Yes. Yes, sir. I didn't mean multitasking. What I want to ask is, suppose I have a friend. She does a course, she learned Chinese language for some time. After that, again, she switched to a digital marketing course. Then again, a few months, she shifted to something else. So I actually asked her, what do you want to do? What is your focus? She's like, how will I know unless I do a few things? So what I'm trying to understand, this kind of a thing, is it normal?
It depends on the normal definition. Like, is she functional in the society? Does she has a like stable relationship? Not in the like the marriage, but with friends, family, and is she earning stable income? Is she sticking to one particular course if she's doing, right? Is she a
But she gets bored very easily, sir. Like she did one White Hat Junior for 2 months, and now White Hat Junior is off. Now it's digital marketing. So again, I've seen like jumping from too many things.
right, right. So you can decide to label her what you wish, but before that, do the diagnostic test, right? So
Okay.
that may be one of the things, but not necessarily ADHD. And whether it is normal or not normal, I always try to do not answer that question, because as a counselor, our role is anyone coming to us, convince them that you are normal. If you someone has labeled you ADHD, I will convince you that your ADHD is a superpower. Use it, right? So Superman knows how to fly, but his parents on Earth, they are always suppressing him. Do not fly because others will what they will think. But once he learns flying, then he helps the Earth. He helps people, right? So probably ADHD is like that. Okay. So why to pull someone down by labeling, no, you are a Superman, so you are abnormal. Actually, that is normal for his planet. Okay. And that is a better than human beings. Okay. So any parent coming to you, either it is for autism or anything, any condition. So number one, you should have a objective to convince them that this is a normal and your child is good and accept it, right, and make the best out of it. If some like this example is there in my book, I have like developed my own. So there is a child who can float. Okay, if a child can float, then don't force the child to walk or run, right? The child cannot walk. Okay, so help the child learn how to fly. You're getting it? So child knows how to float, child does not know how to walk. So this child, you are not going to force to start running. These are normal children who know how to walk, you help them run. But there is a super child who knows how to float, help the child learn how to fly. You like it? Okay. So that's the way you have to help someone with ADHD. Okay, so definitely Kiran does not have ADHD, so not audible means I don't know. There must be network error. Okay. Yeah, before we go to the PP symptoms, Shika asked. Amulya, you cannot ask any question. This is you are never attended any session. After 3 months, you're attending. So, Shika, you can ask. Yes, yes, I will.
So you gave an example of the girl who's not able to make friends, but she's doing good in her studies. But then again, ADHD symptom is that there's difficulty in focusing in school and inability to focus, easily distracted. So how come that goes with getting good marks and all?
Okay, so any condition, there are 10 symptoms, 5 symptoms. It's not necessary that all the symptoms have to be present for the diagnosis. Okay. So for example, ADHD, if she has like there are 10 diagnostic questions. So even 4 are positive, then you can say that most likely this is ADHD. These are all screening tools. These are not the diagnostic tools.
Okay.
And someone with ADHD, there is no rule they will not do good in school. There is no rule that they will not do good. So what are the famous examples of ADHD? Okay, the so-called dumb children, they became the scientists, the Nobel Prize winner, and all those people, right? Okay. Then there are very famous entrepreneurs. Some of them have OCD and some of them have ADHD. Elon Musk, the Tesla and the SpaceX owner, known to have probably ADHD and OCD both. Steve Jobs, complete hopeless case of OCD, right? Okay, the Apple owner, Apple founder. Similarly, Albert Einstein was a known case of ADHD, but became this very famous scientist, right? And among us also, there might be some directors or doctors or famous people. They might have ADHD, but they have become doctors because they have channelized their energy. They have focused their energies to do something good. So there is no written rule that a person with ADHD will not do good. Okay. We'll take next question, please, after some time. Ithil, I will take your question in some time, please. So ADHD typically involves 3 main categories. These 3 not necessarily have to be together. It can be 2 combination or single also, or all the 3 together, very rarely. Inattentive. The child is inattentive. You tell something, the child does not listen, right? And they are thinking of something else or they are planning something else. Hyperactive and impulsive. Right? Third is combination. So, inattentive typically have some dysfunctional areas when it comes to performance in schools and all. Hyperactive and impulsive may be doing good in their work and studies. Typical onset age is 7 years. This is not the onset, it's a diagnostic age most commonly. So if there are 6 or more symptoms and these symptoms are more than if these symptoms are more than 6 months, right? Everyone please take a minute to read this. So the child may have a hard time paying close attention to details. Okay. Detail orientation, you can say, not detail oriented. Difficult to stick with or finish a task or even a game. They want to change the game. It is hard to listen or pay attention. One of the classical is that when they play, they fight a lot. So have you seen your child doing it, or have you been doing it? Or I will give another example. So there is when like boys play cricket, there is always one child who will never get run out. Everyone will say run out, but this particular child will say no, I'm not run out. Always will twist the game, always twist the rules, and will not abide by the rules. This child also have trouble following instructions. It is challenging to stay organized or manage time. So those who always say, sir, very busy, unable to attend sessions, you know what is your diagnosis. Either you are a poor planner, or you are ADHD, or you are hopeless. All the three, no problem. Continue. So if you wish to learn, attend these sessions. You often avoid tasks that require a lot of focus or mental effort. So these people, they typically focus on, they like doing things which involve labor, the physical labor rather than mental labor, right? It may be, for example, the play or athletics or all those things. But if someone with ADHD, they learn how to exert or how to focus on mental effort, that is good. They will excel. Have you noticed a child, when the child has everything is good, but the child frequently loses things? So there can be two diagnoses in this case. One is the child is very insecure, not feeling loved at home, or there is some diagnosis remaining. If other things are there, then it probably ADHD. ADHD people are easily distracted by surroundings or thoughts. And these people are forgetful. They will commit something, they will forget. They will not stick to it. They will commit to self, they will forget. Confidence is weaker. They will commit to others, they will forget. So faith from other people is weaker. That's why a lot of trust issues, relationship issues are there. In impulsivity and hyperactivity symptoms, in impulsivity and hyperactivity, okay, earlier was inattention, right? So again, the 6 symptoms should be present minimum for a period of 6 months. Hyperactive and impulse. As the name suggests, these children will be hyperactive and impulsive, or these people. So impulsive can involve getting into reckless things, rash driving, jumping from height, shopping spree, spending more than the earnings, exhausting the credit card, not planning things, breaking the relations impulsively, getting into relationship impulsively. These are the children or teenagers who are most likely to get involved in the promiscuous relationship. Right? Jumping jobs, being very impulsive, some fight with someone and they just leave the job. Now, the first is fidget or strong need to keep moving, may or may not be ADHD. If you see a child that has a tendency, curiosity to move, may not be necessarily. Okay, so that we should avoid actually. But okay, it is a diagnostic DSM criteria, so we keep it. It's difficult to sit or stay in the class. Yeah, that's a good thing. So the class period is for 45 minutes and still there is an urge to leave the class in between and move around. and do certain activity which you are not intended to do, right? Unable to stick to the plan. Restless not only from the body but also from emotions. Uh, sit quietly in certain scenarios where you are required to. Then ADHD people talk frequently than others or speak without thinking. Okay, so um, may or may not be, but we don't take individually as a diagnostic. Okay, we have to take a lot of things into consideration beyond this also. These are screening questions, not the diagnostic questions. You find it difficult to wait. Okay, so uh, there is a game going on where every child has to play by turn, but one child cannot wait for the turn and has to fight and get in the turn first, right? So there is a queue for everyone, and there is a boy or a girl cannot stand in the queue, has to jump the queue and stand in the front row. So most likely, if you are rushing to the airport just in time and don't want to stand in the queue and always at the front end, you can see you have to undergo this screening tool. You find it difficult to wait. You have a tendency to interrupt others or find it difficult to take turns in a conversation. Someone is talking to you, you are already thinking of 10 other points what you should talk. So that, and you miss what the other person is talking. You completely ignore and you are just thinking of what you want to talk. And before that other person finishes, impulsively you talk and finish what you want to, because there is an urge to talk immediately and urgently, right? And then work is done. There are some people. Any question till now? Yeah, Sujata. Yeah, so Dr. Somila has given good example. Graham Bell, Adam Levine, and all those things. Vinci, Leonardo, Michael Phelps. Michael Phelps, ADHD. Okay, interesting. I thought he has what is that? Dr. Sunita, what is that syndrome? Long arms and long legs, and what is that? Phelps. It comes when father is more than 40 years. What is the syndrome name? Michael Phelps, the swimmer has. Uh, the upper body is longer than the lower body, and sometimes there is a disease of the heart also. Marfan syndrome. Okay, thank you, Dr. Anupama. Okay, right, Marfan syndrome. So I think Michael Phelps has Marfan syndrome, right? He has ADHD. I'm not aware, but it's okay. That's good. Good to know. Okay. So, Dr. Varsha, very good question. So, any disease, any condition, we should avoid labeling, because that label sticks on the forehead for the lifetime. And whenever the person sees himself or herself in the mirror, that label is visible. Number one problem. The other is all the people, they change their interaction. Right? So there is a subconscious inhibition to make friends. I will give everyone a wonderful story. There was one high school boy, and very average, happy go lucky, not doing good things. And just to answer Dr. Varsha's question, huh? So you will find it very interesting now and will be relate. Uh, Happy go lucky and not aspirational or all those things. All friends are talented, studious, and this child is always playing and all those things, not focusing on studies. Now it comes from for the time for college, and everyone appears SAT exam. In US, they have SAT exam for college, and everyone scores average. But this boy, by mistake, scores 400, 1420. right? It's one of the good score, gets a decent scholarship, and goes to a very good college and gets a salary of $100,000 per year. Very good, everything is good, right? And lives a life of a super performer or superior manager, good employer, sorry, good employee, and rises to a good corporate and earning good and everything. The life is has become smooth now. And after 10 years, he receives a letter. After 10 years into his job, he receives a letter from the university stating that that particular year there was a scoring error, and actually he failed the SAT exam. And the other friends also received the letter that there was a scoring error. They had actually scored the good marks. Okay. So this boy, though was a mediocre from all his capacities, but by mistake believed that he is the super performer. He is the SAT high scorer. And he believed in that and he lived that life. And that's why he could achieve highest potential. All his friends, though had a higher mental capacity or intellectual capacity, they scored low in SAT. They believed that they are poor performer and they lived a mediocre life. So when you label someone ADHD, that person will live probably a mediocre life unless you equip someone how to live a better life. It is better to convince someone that whatever you have or whatever symptoms you are manifesting or whatever life you are living is good. Make the best out of it. You have certain problems, certain conditions, certain symptoms, certain things, certain behavior. Use it to grow. Right? You have OCD, use it for painting, fine arts, writing book, or something. You have ADHD, use it for networking, doing different tasks, dividing your work, controlling your impulse. If you just control your impulse, you will do good. Right? So train them how to control their impulse, small things. So it is always better not to label someone. But if someone is labeled, now they need our help, then it is next step. And other is we can know from our perspective that okay, this person has certain things. You can tell them without labeling that you will need, or you can tell the parents that this is going to be the trajectory of the life. If you take my intervention, if you follow this steps, this is going to be the another trajectory. You can choose what you want. So you want to live your life, or you want your child to live your life of believer that the child is a high SAT scorer or the average scorer. And I will make your child believe that he or she is the high SAT scorer. And I will give you the techniques to control the impulses. True. And that's how astrology also works. Right? The funny thing is that if someone says that, you are going to study till this only this much, right? And then every time the hurdle going to come, okay, and then there is a small hurdle in your education, you will drop out, right? If you have aspiration to become entrepreneur or start your business, and some astrologer or someone says you believe in someone and says that okay, you will always do a job, right? You cannot, okay, do something, and then the some hurdle is going to come, right? Starting a business and doing a business is tough, more tough than doing a job, because you have to work for yourself. That is the most tough thing actually. And the biggest thing you have to overcome is yourself. You are your greatest enemy when you are entrepreneur, right? You need to have a very strong motivation, and a lot of troubles are going to come. And if with the first trouble people drop out, right? Today is very difficult, tomorrow is going to be more difficult, and day after tomorrow is beautiful, but most people will die tomorrow. They don't see over tomorrow. So one of the astrologer had said to my parents and me that I will study till 12th standard. I had lot of tremendous difficulties while doing my MBBS. Uh, Probably learning disabilities or financial difficulties and lot of troubles and lot many things and family troubles and all those lot of things. I could do my MBBS with very good score and one of the top 10 score from government medical college. Also, I did masters then subsequently, which was against all astronomical odds. Till now, when any astrologer sees my Kundali says, okay, this boy must be 12th standard. I say, yeah, actually, all my degrees are from Amazon. Right. So that's how it works. So it's not necessary if someone labels you something that is going to stick to your life. Okay, it's about what you do. Yeah, that's good. That's Varsha, very good. Very rare. That is a very rare quality. Dr. Varsha comes from pharmaceutical industry and entrepreneur now since 2-3 years and has started a wellness business. Uh, it takes tremendous efforts and that's a very rare quality. A rare person who is able to do that. And what Dr. Varsha you are talking is a very rare trait. If you say someone something that okay, you cannot do that, and that person takes it as a challenge and accomplishes things, that is a very rare scenario. 1 in 1 million actually, probably, right? And I personally believe that if someone says you cannot do something, no need to fight that person, no need to prove to that person, right? Actually, that person is not your enemy. Your biggest enemy is you. The biggest hurdle is you. You are your own biggest hurdle. You have to overcome your problems, right? So if you see some science fiction movie or something, so there is a what is that? X-Men Apocalypse. Have you seen that movie? There is a villain and he tries to control the Charles mind. Okay, Charles Xavier's mind, our professor, and he's trying to destroy the earth. So Charles has to control his mind, right? He cannot, there is nothing else to control. He has to control his mind through the willpower, right? The objective is to not to fight the enemy, not to fight the villain, but to fight own impulses, own negative, own dark traits. Everyone has our dark traits. We fall to that path and we need to fight for that. We need to fight against that and come out of it. That is that takes a lot of willpower, right? And you are blessed if you get someone to support you for that, either a friend or very rarely a life partner or a mentor. So you are really blessed. But the effort you have to do, the fighting part you have to do. Yeah, that's great. So one time I will invite Dr. Varsha to introduce about her business, the model and all. So I will discuss with her. So what she's doing is Dr. Varsha Narayanam, very good, interesting work she's doing in the wellness space. Okay. Other symptoms: daydreaming, conflict at school or with friends, difficult to get along, difficult to play, difficult to wait for turns, not abiding by the rules of the game, trying to twist the game, trying not to obey, or never agreeing to the rules. If the child is out any game, so will not acknowledge out, will fight, no, not out. Right? Taking unnecessary risks, running into the street without looking, rash driving, all those unnecessary risky behaviors, difficulty playing quietly, squirming, fidgeting, having a hard time taking turns or being patient, running around or climbing trees or doing all those things which all the monkeys will do, right? And unable to respect others, self, all those things. Okay. So how do you manage or help these ADHD people? Read the book. I have written practical solutions for each condition, the real life practical solutions, and you will enjoy. You will get it. It's part of your syllabus. Those who have waited the previous batch, almost 60% of the previous batch, they have um, waited for it. They have said, okay, sir, we'll wait for the new book. So that's great. You will get it. It's the best thing. You will love it. Okay, fine. And the new batch for August batch, it is already there. So I have sold the book to NHCA. You will get it. Huh. Okay, so questions? Then we start something. I need it. I want it. That's really good. Good statements. The bad statement is I wish I had. Okay, you wish, keep wishing. But if you say I want it, okay, good, you will get it. I need it, okay, you will get it. Okay, fine. Obviously, most of you will get it. Previous batch students, some of you are my favorite, so you are going to get. So you know what you need to do. Send me the feedback video, the career guidance video about your journey with NSCA. Right. We start with a brief about the next batch. Okay.